With fall just around the corner, Philadelphia officials are making moves to help keep the number of COVID-19 cases down. Joining us now live this morning is Philadelphia Health Commissioner Dr. Thomas Farley. Dr. Farley, thanks for your time. Good to see you. So first, we want to talk about the new guidelines just announced for sports that's affecting thousands of youth and high school players. Contact sports, or sports that are deemed high risk, including football and soccer. They can practice, but they can't play games. So a lot of parents want to know, how did the city and health officials reach this decision?
Well, we're worried about the risk of students, children passing the infection from one to another. And it's a number of different groups around the country and cities have thought about what sports are more risky. Including things like tackle football. There's an awful lot of contact between people, an awful lot of spread of respiratory secretions. And so we don't think those are safe. And so we made that policy that to prevent those high risk and contact sport competitions, allow them to practice so they can build their skills. And then for non-contact sports like cross country and track and field and crew, they can practice and have competitions.
All right, so we've been hearing from a lot of parents, as we said, who say that their kids, they've been playing for club teams during the summer. They say they haven't had any issues, and a lot are starting to express concern about the mental health of the athletes that aren't able to play. You know, sports is such a great outlet for students and kids. What do you have to say to those kids who aren't able to play?
You know, this is tough for them. I appreciate that problem, and I'm sure the parents are not happy about that. I'm sure the students are not happy about that. On the other hand, we don't want the children to get the infection. We don't want them to bring it home to their parents and their family members. And there's an awful lot of things that can be done outside safely, a lot of skills that probably all the children need to build in those sports. So we do think that we can get through this and they can get some benefit mentally as well as physically for that kind of practicing.
All right, well, shifting gears here now, you guys have been keeping a close eye on college campuses, especially Temple University, where we've seen that recent increase in positive cases. A lot of those cases, as we've been told, primarily connected to off-campus housing. And earlier this week, the department had a testing clinic on Temple's campus. What other steps are being taken to try to get ahead of this outbreak there?
Well, we're working very closely with the university officials, first to make testing available, as you say, then also do contact tracing. So we talk to the students who have a positive test and see who they've been exposed to, and try to have those people stay away from others so they don't pass the infection further on. Then the university, as you know, has switched to all online classes for 2 weeks while they determine what they want to do over the long term. We hope that combination really quells that outbreak. It definitely is a lot of cases right now, and we don't want it to get any worse.
All right, so next week, restaurants in the city, they will be reopening for indoor dining at 25% capacity. A lot of people have been looking forward to this. And it's also the unofficial end of the summer this weekend, Labor Day weekend. So as we head into the fall, how are you feeling about the numbers here in the city, and what will you be looking at, zeroing in at, as we get into this fall season?
Well, you know, it's hard to predict what's going to happen with this virus, but in general, most respiratory viruses tend to get worse in the fall and in the winter. So we need to be very careful. So we are allowing indoor dining, but with some very sharp safety restrictions, like 25% capacity, as you said. Servers have to wear masks as well as face shields, no more than 4 people at a table, tables more than 6 feet apart. So we got to be a little careful on that. We're going to have to be careful otherwise. We're starting to see some increases around the country, particularly in college towns. And I think the trend is probably more likely to be up than down over the next few months. It's very unpredictable. I can't say for sure. So we still need to be very careful. And
you are urging people to get their flu shots as well.
Absolutely. People should get the flu shots. This is one thing that we can control. The flu is a safe vaccine. It's an effective vaccine. Even if it doesn't totally prevent you from getting the flu, it prevents you from getting a severe case of the flu. And so the flu vaccine is available in many pharmacies around the city, most doctors' offices. So people should start planning now.